Greetings to everyone. I welcome you all to another session of Physio TV. Today we are going to talk about physiotherapy rehabilitation for proximal tibia fractures. Before starting, I would like to tell you that proximal tibia fractures account for mostly 1% in adult population and 8% in the young elder population according to the recent stats. So when we talk about proximal tibia fractures, usually people what they do is they consider it as tibial plateau fractures, right? But that's not the right terminology. As you can see, the fracture that occurs over here consists of the tibia also, not just the facets of the tibia, tibial plateau, right? So when we talk about proximal tibia fractures, we are considering the lateral condyle, medial condyle, and the upper portion of the tibia, proximal portion of the tibia, that is 10 to 12 centimeters from your mechanism of injury. As I said, that younger population is mostly sustained, mostly prone to these kind of injury. So that is because of road traffic accident, high intensity trauma. So what happens is that high intensity trauma leads to increased axial or torsional forces to the proximal tibia, which can lead to the fracture. Older population usually are have this injury because of low energy trauma due to simple falls. So as we age, chances of fragility of bone due to osteoporosis is more. So even a simple fall can lead to fractures in these cases. Okay. So coming to the classification, how do we determine that how severe the fracture is? We have a classification for that. That is Shatzer classification, which is usually identified from the X-ray. X-ray, there are also some different classification. This one is the most common one that we usually follow. See, over here, the fracture is, you know, divided into different type of fracture. The type of fracture determines the severity of the fracture. But to analyze the depth of the fracture, we need CT scan, and that's more, you know, uh, standard way to find it out. But for to determine which type of fracture and how much is the severity, we can go with Schatzer classification. So this is divided into three different parts: type 1, 2, 3, 4, 5, and 6. So type 1, 2, and 3 are mostly on the lateral side of the tibia, whereas type 4, 5, 6 are on the medial side of the tibia, means the medial condyle is getting affected. If you can see over here, type 1 fracture is at the lateral tibial plateau and the condyle, and there's a split fracture over here, right? And with displacement. Type 2 fracture over here is on the lateral with split and depression. There is also a depression. Here just the split is there, but your split plus depression is there. All right. Here the articular surface is depressed, whereas type 3 over here, this is an isolated depression fractures. This kind of fracture are usually common in older population, whereas type 1 fracture are usually common in younger patients. Type 4, 5, 6 is uh, on the medial condyle of the tibial plateau. Type 4 is over here, split. This is a split depression or split depression, both fracture. This is associated with high energy trauma, and here there is a chance of vascular injury too. Type 5 over here is due to the involvement of the lateral and the medial condyle. This is also called as bicondylar fracture, and you can see over here there's an inverted Y shape. If you can identify over here, there's inverted Y shape fracture. Type 6 over here is either of medial or lateral tibial plateau with a second fracture line over here separating the metaphysis of the diaphysis from the diaphysis. All right, so these kind of fracture are very complicated fracture and are more of these kind of fracture mostly involve the high energy trauma. For any fracture, the time for bone healing is 10 to 12 weeks. But depending on the type of fracture, if you can see over here, type 1 fracture is the least complicated one over here, right? It's just displacement, there is no depression and all. So for these kind of fracture, usually the healing takes place at 8 weeks. But the rehab program for these kind of fractures run through 16 to 14 to 20 weeks. So when we design a protocol, we need to follow the timelines for this. Methods of treatment, there are two ways, non-operative and operative. So the non-operative, we usually go with above knee plaster cast or close reduction and traction followed by brace. For operative, we usually go with open reduction, internal fixation or external fixator if there is a severe case. Hinge knee, these are the this is a photo of open reduction internal fixation. Here you can see a plating is done. This is for higher end since it goes till here. This is a photo of external fixator. In complicated cases, we usually go with external fixator. Hinge knee orthosis is usually prescribed for the patients with after the surgery. After a brief period of immobilization, we usually switch to hinge orthosis so that the patient is able to move his knee, but there is also stability which is provided by to the joint by the brace.